You are watching Liberty Online TV.
I deserve the best. Leave that X to the next. Hi guys, it's Boy here, aka Miss Kelly Talat. And Falona, all know say you suppose you need for check out Liberty TV online on every platform if you want to get the best form of entertainment in your life. So make sure you check them out.
What's good, guys? I'm Peter, AA Komba. Watch, make we left for the greedy, and let we left for the greedy because our when I'm going to check out Liberty Online TV now all social media platform, and if you want to get the best entertainment, watch out for them and always check them out.
Hey guys, this now you got Aminish. I dey follow Liberty Online TV, and I want you to follow Liberty Online TV. Now Facebook, now YouTube, and all other social media platforms.
My name is Leader Howard Tombo, Team Bikenda Mama, and the winner of House of Star reality TV show season 1. I am right at Liberty TV, and I'm encouraging every Sierra Leoneans and every other nationality to always watch the Liberty TV. It's an online TV, and encouraging you also go and follow their page on Facebook, YouTube, TikTok, Instagram, Twitter, and then you can get the best out of Liberty TV.
Hey guys, what's up? This is incredible JJ, Mr. Hodos J. Shout out to Liberty Online TV. Follow them on all social media platforms. Hodos J.
This is Liberty Online TV powered by Orange Sierra Leone. Orange.
Good morning and welcome to another edition of the Breakfast Show, where they come to you live na Liberty Online Television at the different platform them osai on the get with this morning. Members say we are being powered by Orange Sierra Leone, and we want to say plenty thank you to on all where they follow Liberty Online Television at the different platform them osai on the get we. We will bring come this edition of the Breakfast Show to you. Me na Mabel Kaba.
And me na Al Hassan Kuma. Good morning. Today na Thursday, April 11, and inside this edition of the Breakfast Show, we'll look at health with a special focus on the in-vitro facility where the Sarah Hope Clinic don't introduce for help women and get speaking in a salon. And so we'll look at the first successful birth case where they don't do through this particular process.
All right, well, as Al Hassan on Selona, today inside this edition of the Breakfast Show, with theme na health, also we can look at the in-vitro fertility method, where one hospital, when a clinic actually, where they focus purely on helping women them for able to get speaking. Well, waiting at the procedure for IVF when so plenty people they call them, and waiting it take for let somebody go through this particular method for able to get speaking. All of that we can discuss now this edition of the Breakfast Show. And for can't talk about that, now a pleasure for welcome this morning at the studio, Justina Jallo Jamboria, where now the CEO for Sierra Hope Facility Clinic. Sierra Hope Fertility Clinic. Good morning and welcome to the Breakfast Show. All right, now a pleasure for getting here this morning. And like I don't tell the viewers them, today we can't talk about, well, then go say just on a woman business, on a woman health, on a woman business. Anyway, how then talk now. But this morning we focus on how on the help salon woman them for able to get speaking. We know say popularly people on the talk about IVF, now other can't give them, but Sierra Leone ever really like woman wait on the struggle for get speaking, go through this method, and una don't get to a first successful case. Firstly, congratulations on that. As we can't talk about the whole method itself, what thing it will take woman for go through this method and able for get a young picking. Well, let me first know first why you named the clinic Sierra Hope. Let me start with the name before we can go inside the work itself.
Thank you so much for our host with this morning. Well, we named the clinic Sierra Hope now for just bring hope to Sierra Leone and them. That we safely bring this service can to people in a salon and the couple, and because I don't like for say woman there, not only the struggle for fertility. So I go say to the people who struggle for fertility.
So now they treat both man and woman?
Yes.
All right, so take me through the clinic itself.
Okay. So in terms of structure of the clinic, we first step now for make sure say the couple and come for screening. So we get a principle. If we don't see the woman for 3 visits, a man will come, then we say we'll stop service. The reason being, the woman in need to forget belly by himself. So if we not test the man, we're not going to see problem self they come up from the man on side.
Okay.
And then after the testing, then we can decide now which one are the right treatment for this couple, because now they all two they treat together. So not to everybody we can't we they say na IVF na the only thing we for do. But then they come, we screen based on the result, and we can determine which are the best option for them.
So you make mention, say, if woman, like for example, long gonna the clinic for 3 times, and now come with the man, and another continue with treatment.
Yes.
So what if na woman way perhaps not a couple, not married, but he wants to get picking?
No, so what I mean by that, say if you come 3 times, we know they treat, we know they continue. If the woman come, then we see say he get problem what we need for take care of. Yes, he can continue for color take care of her. But if he come, we don't do all the testing. In testing, then fine. Then now we need for us to check the man and make sure say no issue will come up from inside. If not more we not married, then one single person. So we continue with the treatment on your own side.
Apart from the fertility, any other thing they want to do for the woman then?
Yes. So we get for look at the reason of the infertility. Okay. So if the problem get for do with maybe it gets endometriosis, which the abnormal growth of the within the inside the woman womb, they grow outside the body, then we can treat that. So based on the primary testing, would determine the way we treat the woman or the way we will continue with treatment. So apart from that, they would take care of people who then get fibroids, would they take care of people and way. If there are tubal issues, then definitely we'll advise on which way to go with that.
Yeah, because I will keep the major parts of the discussion we get for do with the IVF.
With the IVF, okay.
For the peak of the program. So let me start with the other thing and first, where the clinic, the other facilities they want to get, and the other treatment they want to give out to people.
So the other treatment we they give with sister branch within Joy, we get like an I would say emergency area where if anybody get the regular sickness, they can go there, they can treat that one day. And also the pediatric section also they take care of them small picking there since we don't begin get picking there now. So and then we treat normal disease process like hypertension, diabetes, that one and they also.
You make mention of fibroid. Let me begin the conversation with them.
Okay.
For example, somebody where they watch you, then I also don't know whether or not a fibroid or waiting it gets, waiting are the signs them where they begin show for make somebody member say la gonna Sierra Hope or any clinic for go check waiting they do me.
Okay, so first of all, what I go say, anybody we don't try for get picking. If you older, if you be 35 and below, you don't try for 1 year for get picking. It not happen. I go say see doctor. If you are 35 and above, you don't try for 6 months. You not get picking. I go say go see doctor. With that, they will also go be treated and will also go be tested and then see if a fibroid are the issue or whatever it is the issue be. But if you don't try for at least for 1 year for get picking, it not happen. Will also for go see doctor. You and the man.
So the fibroid, are they able for to get them?
So the fibroid, depending on the size of the fibroid, depending on which side the fibroid is, also can determine if na surgery we need for do or we can still continue treatment without that. If the fibroid be too big and it is a place where I go threaten the picking, yes, we recommend surgery.
When I can do the surgery now?
Yes.
What's the procedure? Like, for example, somebody go to the clinic until night before diagnosis, something a fibroid get. Take me through the procedure.
So when the person come to we, as I say, we do the testing. The testing will be ultrasound. The ultrasound will show we if the person get fibroid or not to fibroid, because some signs of fibroid can be, say, they get prolonged bleeding, meaning they bleed a lot. As a woman, when they see you period, they bleed plenty, they get plenty belly heart. But that can also be due to something else, not only fibroid. So normally woman they say, okay, because I bleed plenty or because my period heavy means in a fibroid. No. The best thing can be do ultrasound. The ultrasound will show whether a fibroid you get or not a fibroid you get. So when you come part of with pre-screening, involve ultrasound, involve blood test, also for check the woman in hormone levels them.
What's the cause fibroid?
So even the international world don't know yet what cause fibroid. Then we don't speculate based on the research we then do in the US for say because now more of we black people in the get then they speculate it get for do with some chemicals, but there is no proof in it. There is not a definite thing.
What are some of the key things and way they cause women not for being fertile, you know?
Okay. So key things we can make a woman not able for born or be fertile can be one, it can be say irregular menses, meaning this woman in the same period I foresee. You know, so one thing I would advise all the women there is that make sure see the right period, the date the way they see period. Because the first thing that they look at, if this woman the mess I for mess, then one. And then the second thing also can be say get a condition where they call PCOS, when a polycystic ovarian syndrome. Then in the basically there is no definite test for say you get this now in. So we can look at various things. One, we look at the ovaries, how the ovaries then they with the follicles they then they inside the follicles then basically now they the egg then can they. So when we look at the follicles, we also look at the woman in lab test them, and then we look at and see how the follicles they arrange. We look at even the woman own structure, self can tell we if this woman get PCOS. So it can be say as I say PCOS, it can be say the woman in tube them block. It can be say the woman in menses regular. So all of that they can contribute to infertility. And then definitely on the man your own side back. So if the man definitely produce sperm, then definitely this woman will get belly.
Okay. There are some complications that can be with regards to when two couples then get married and they look out for picking. The two couples then can find it very difficult now when hospital for know who that get the problem. You can produce sperm as a man, but some people can say medical wise until the sperm not too strong for you before give that woman the belly.
So where we they do semen analysis, we they look at three things. One, we they look at the count where the man produced. The normal count for be at least 20 million. So every ejaculation, if the man will look at the sperm, it will be at least at 20 million. So anything less than that, there is a problem. And then the next one to look at now, what they call motility. So you go get a man who go produce 100 million sperm, but in sperm then they swim as fast as they need for swim. Then you go get somebody where they produce maybe 50 million, but in sperm they're strong enough for swim. You know, so they look at the count where you produce, so they look at what they call the motility, meaning how the sperm they move, and also they look at the morphology, meaning the shape of the sperm. You know, they look at the head of the sperm, if the sperm is strong enough for able to pierce through the egg, or they look at even the shape, the tail of the sperm. So if there is any dysfunction within the head and the tail of the sperm, they will not say it will be difficult for this man to get this woman belly.
Any prescribed treatment for short man that we know they for produce that kind of?
So it depends. When we do this semen analysis, if the man they produce sperm, then we can look at sometimes reason we can make a man they produce sperm, but his sperm not so plenty or not so strong can be infection. So if an infection are the reason, then we can prescribe antibiotic, then we come back and retest, and then we can put the man also on antioxidant. Then for just help get rid of anything within the man's body we're not supposed for day. So it will help for eradicate that day. And then after 72 to 90 days, we can come back and repeat, because now by then the man for begin produce new sperm.
Now, through say regular intercourse, for example, they make the man them sperm counts drop?
No. Sometimes, and I would say not also, because if the man already gets low sperm count, then definitely go reduce. Because every time a man ejaculates, they're supposed to produce sperm, because they already get millions of sperm waiting at the scrotum or I go say the testis where the weight there. So every time we ejaculate, then if we're able to produce sperm. But if the man already get challenged, then yes, when it's ejaculated, they produce less and less sperm.
So how we gonna say he gets this challenge? Because most times, if couple and they, for example, they don't married 1 year, 2 years don't pass, they blame now we on setting this kind Africa also when safe. They blame they go to the woman, so now the woman not able for conceive. So how the man go able for no say incest related to this, where for example, someone not even get the confidence say, la go now hospital go check, maybe na me get the issue.
Well, one thing I don't discover is that we can be confusing to man. Then they look at and say another problem for erect, you know. Then from there another problem for ejaculate. Anytime I sleep with 2 man, are they able for erect? But not wait till you they see with you, I not to the sperm down there. The sperm we only able for see under a microscope. So now make we they say if you the woman don't go for treatment and the man they join you, then it not make sense. You know. So the best thing is get tested and you know how you stand, you as a man. You know, so now to you the man and the woman now to get the test done and then we're going to understand if not the issue there with the man, then we can try for help on that side.
The issue of infertility, if we talk about weight gain, past mark weight, so somebody like then can say you fat, they get anything to do with that? Because at times then they see some woman we get body, then say this time body making not able born.
Body for everybody not too good. So even if not to fertility no more, you try for struggle with because when you gain too much weight, they open to other medical issues like hypertension, diabetes, and even when time we talk about the PCOS. Because one of the signs of somebody will get PCOS now weight gain. And the more weight you get, the more it unbog your ovaries, outside the egg, then they come out.
Yeah. So it gets the direct connection?
Yes. You get direct connection with infertility.
So we will look at the IVF itself. Firstly, why una think of say we need this kind of facility in a salon? Is it that una do survey, we don't show say woman then there are plenty we need for go through this procedure because we know say they happen in other countries them.
Well, when we look at it, myself I conceived me last speaking through IVF, and I also get me relative and also we need fertility treatment, and then see doctor over and over. There is nothing more they can do. Unfortunately, the spouse is unable for travel for go meet them out of the country. So we look at it and say, why not we bring the service here? You know, if they bring other doctors and for can do surgeries and other things, yes, we can bring specialists and for come back in a salon and can provide this service.
Well, they can't talk about the service itself, but it's possible for a woman, for example, we don't get in one first, second picking, for example, it gets no issues, no day, but ready for get picking back, not able, if possible.
Yes, so that one we call it secondary infertility, and as woman they get older, so also the egg quality of the woman they drop. Now that make them advise say born picking as early as possible, and also where they can part of we pre-screening. Now the questions we can ask. One, the picking will be born for this same man, we born them. You know, if you be say yes with the same man, then we can look at say okay, we'll look at the egg and maybe now other things that don't come in now we make maybe even the tubes that don't block. You know, so yes, you can born picking and then after a while you begin struggle for get picking afterwards.
What can cause that?
It can be say maybe even the tubes or the age of the woman towards the age they increase can cause the eggs are not for work as they're supposed to work.
Which age appropriate for a woman get picking for let you not go face this difficulty if not the age now one reason?
So in terms of age-wise, they can always they say, what me go say when you're ready. Because now with the thing of IVF, woman can still able to harvest the eggs and we freeze them. But I go say, if you're possible already, even if you're ready in your 20s, it better get picking as young as possible. So I go say, in terms of medical-wise, less than 35, I go say, if you're ready.
On this what's the latest age? Sorry.
35 and below. If as I say, but that necessarily depends if you do woman ready. Because if you're not a career woman, you're not ready for say one picking, I go say no born picking, you're not ready.
But you say when they keep the eggs then
yes.
If, for example, woman not ready for getting picking, they can go now on a clinics and say I want can preserve my eggs, so ready I go come?
Yes. So if the woman not say right now get something else for pursue, you can come, we retrieve the egg them, even if you are 20, 25, whatever you age be 30, you want we for freeze the egg, we can come, we retrieve them and we keep them for you. We ready can take them back.
How long this IVF takes sperm?
The process itself? So from pre-screening to the time to do the IVF, it varies. Because you will get somebody we go come, you go get a couple with them come. We don't do all the tests, everything fine on the woman inside, everything fine on the man inside. Then we can just move them straight maybe the next month or two, because we not get anything else for prepare for them. So in that case, from the time of stimulation, where we start for give the woman injection for let it produce plenty egg, to the time where they say we do the transfer, it can usually be between the stimulation itself can go anywhere between 10 to 14 days. And then we can take anywhere between 3 to 5 days for monitor the embryo there for see how it develop, we transfer them. And then we'll take 14 days after the transfer of the embryo for look at, say, for test for pregnancy. So I would say anywhere between 6 to 8 weeks.
Okay. For Sierra Leone, we know say plenty time because this facility new, and people they will just believe say if I not flag over to go do, they not go believe. Is this a purely Sierra Leonean owned and operated clinic?
So the clinic owned, yes, by Sierra Leonean, but when it comes to the service itself, not foreigners of the bring come, because unfortunately, we not get Sierra Leonean doctors there yet. We get experience in IVF, you know. So we are open to train Sierra Leoneans who don't want to get experience in IVF under the embryology part. Now the embryologists now they put the egg and the sperm together. That's a new field. That's why I think say people have for pursue. Then when it comes to even the egg retrieval, they get for be a specialist for do that. So no, we specialists and they come up from outside for come.
When I don't get to our first successful case, but even though this first successful case don't come out and it prove for be good, let me take the challenges then we're related to somebody going for IVF or for go preserve in eggs. We all know the situation of example electricity challenges, and for do preservation, we all know what it will take. How una don they work towards this for ensure say the challenges them where they under not affect somebody sometimes go sell preserve me egg and una get issues.
So the egg freezing or embryo freezing not they happen with light. It they happen with nitrogen liquid. So currently with the important from Ghana for CAM, because we not get a company at Nasalon where they produce nitrogen liquid. So that would be used for preserve the embryo with the nitrogen liquid. So not to light.
The IVF itself now we now in the focus of this edition of the breakfast show where we talk about the IVF for let person go through and get pikin. Waiting at the risk we involved, because perhaps somebody they will go and go through but they forget to say something will happen. Risk then they will involve.
Yeah, so one of the main risks we come with IVF, I go say now possibility of getting multiples. I know say a lot of people already in the call we say I want to get twin, but then they come with a great risk, because the more pikin you get, even natural pregnancy, the more pikin you get, the greater chance will lead to miscarriage, the greater chance will be say the pikin and go born with low birth weight. You know, so that are mostly of the challenges and when they come with IVF.
How the IVF they work? For some woman ways until they watch you, or man ways until they watch you, they don't marry for long, they want pikin, but they know nobody's option. How it they work?
So IVF basically they work when they put the woman on medication. The purpose of the medicine are for help the woman for produce plenty egg. If the woman younger, if the woman don't pass 40, and we'll do in blood test, and we see say the quantity of the egg when there's a test when they call AMH. Go tell we say this woman need to produce that much egg again. We can advise and say use a much younger egg for like go get a greater chance of say go get success. So if the woman don't pass 40, or even if not to 47, based on the test the guide way on how to proceed with this woman. If we see say AMH very low, we advise for use donor egg. And then with the man, with the process the be when we harvest the egg from the woman, we also they get the man in sperm at that time and put them together. So if we want to a chance to say the man in sperm very, very poor, we get a procedure we then call ICSI, where in cytoplasmic sperm injection. Basically, the machine pick up the egg, it pick up the sperm, then it pierce the sperm inside the egg for getting a chance of fertilization. We can use that procedure there. But then if we want to a place outside BC, the man need to produce sperm at all, because they do get man they need to produce sperm because of different reasons. Then we can advise for use a donor sperm, which is a great challenge.
Because that's about to ask you say if you talk about donor sperm, now this place Leone as it is. If people and they were really go willing say la use donor sperm where tomorrow go they pass that it begin your other thing.
Well, me I can tell people and say you choose what you want people to talk about, because no matter what people will talk. Where you born picking, one picking, they say this and one picking born. You born plenty, they say Bobo picking. You're not born, they say you're not born. So you decide. And when it comes to you using a donor sperm, nobody know they know. Now between you, your wife, and we, you know, now we didn't know say yes, we don't opt for this option because there are certain situations where you not go change. I don't care what kind of treatment we do, I don't care what we do, you know, there are some men will not go ever produce sperm. Because the issue not start where they don't grow, the issue start from where them baby, some of them from even inside the mama womb, now they don't start. So there is no way it will change. So then one day we can, with the advice and with the encourage, say go for the donor. If you just tune in, you watch the Liberty Breakfast Show, and this edition of the Breakfast Show with Timna Health. Also, we talk about IVF, when an option way for the people and working one speaking able to go through the clinic procedures them for use this method for get speaking. So in case you get any comments for make or any question for ask regarding IVF, when at the first time this with the year say Sierra Leone don't get clinic where somebody don't go through and they don't get them first successful case where the person go through this IVF method and not able to get speaking. Later in the program we go for bring to a report. Also we go work at the clinic and see waiting they happen. They bought at the studio this morning. We get Justina Jello Jamboria, when are the CEO for Sierra Hope Facility Clinic, when are they do this particular method for help people forget speaking. You make mention just now about some man and they way at all it's not possible for let them able to get egg, we go able for make picking come out of them. The one them way, for example, they come from, you say from them baby. What's in the cause them? So we get different things where they cause them. For the way they get a condition where they call climate factor defect. The other one then instead of them get just one X of the chromosome XY, then gets 2X. So that one and there's almost impossibility say they could produce sperm. There's a little chance that we can go through the scrotum and aspirate the sperm from there. But also some of them, they will maybe when they baby, then test this, basically the balls not descend candle. So I will use this opportunity for say, where you born boy picking, make sure say you check them as soon as you born. Make sure say the two testes, the two balls, they don't at the sac. You know, because the longer it take up the body, the more it damage. You know. So now the Combra go able to check for himself or you need for let them check now hospital? So the doctor can check, then himself can able for check. Because once you hold the scrotal sac, he came for check them and squeeze them and see say they all two descend. The meaning they all two go down them for them at the sac. It's possible for let somebody to go through the IVF method, then you know be successful at the end? Yes. So all over the world, IVF success percent they are around 40. Major reach of the clinic them they are about 40%. So yes, it do possible. So we can do certain things and for improve the success rate, which can come in as somebody say one of them can be donor eggs. So if you're not older person, we can advise you use a younger, much younger egg. We will give greater chance. Then even when it comes to the man on your own side, there are certain defects we can also they part the sperm. When within the DNA itself of the sperm, we can cause the issue for letting the implantation not take place. Any differences there between picking the way they go through the IVF and the one that we go through the normal process? In terms of development and after birth as well, then behavior-wise, physical outlook and all that. So based on research, there is not much. It's about maybe 1%. And the waiting that they think about is that most of the people that go through IVF, they are much older people anyway, from get-go. So they look at it and say, possibility saying that because the woman already older, that then they make these challenges that actually happen, not so because of the IVF process itself. So it's only about 1% difference. What are the complications then we attached to where they come with? The IVF. The IVF itself. So from the beginning of the IVF to the ending, one, I would say the first one for the woman, the one they give this medication, they also follow produce plenty egg, then get a syndrome what they call OHSS, when ovarian hyperstimulation syndrome. So that is a condition where you do man they notice because it's not like a subtle issue. You don't know say you feel there's things that you feel within yourself, like you feel really full, you feel like say your legs then swell, you know. So that is one of the conditions, and there is a treatment what they give for that. So we can advise you make you tell we immediately when you begin for experience down there. So we will give medicine for help for limiter part day. Then even when it comes to the egg retrieval part, we put the woman under anesthesia. So right now there is no complication in terms of widow experience, but anything can happen when you put somebody under anesthesia. So that's also another challenge which can happen. And then of course when it comes to the transfer part, all man hope say it go work, then it not work.
Is it painful, the egg retrieval process?
No. Because you sleep, so they know. When you wake, by the time you wake, you only get like little cramp, just like when you go say you period of pain. That's how it be. And once you take some like paracetamol, it pain for control.
Is it possible for somebody to go through this method, then give birth before the time, or not they expect say the egg for the mature? Like when they say premature birth?
Yes. So premature birth can happen in both natural pregnancy and also IVF pregnancy. As I said, there is not much difference in both because not only IVF really they contribute to harm per se, it's more of the woman, and also if not multiple pregnancies. I mean, you get boku pikin inside womb at that time. Maybe twin, triplet, quads. I not say that that's all I want, but not good. Then it can put a challenge on the woman for born early.
What can cause miscarriage when somebody they do IVF?
So it can be, say, as I said, the age of the woman. So the miscarriage really not to say that IVF they cause the miscarriage. The reason why make this woman don't be infertile all this time can be a contributing factor to why they get the miscarriage. Meaning even before the woman can't reset for IVF, maybe they get miscarriages before, than one. Or then maybe even the uterus self normally accept picking and that making normally get pregnant. So even when we do this transfer of the embryo, it will start for attach, but at the end, it end up for they continue for attach. They end up for get miscarriage at that stage there.
Based on the cases them way on don't they get since when I begin operate to now, infertility common na salon?
Yes. Even I believe a study done by WHO we say the number of basically the amount of picking when they born every year don't seem for the reduced na salon.
So on a normal, for example, for the week, how many cases you can get?
I would say anywhere between 3 to 4 patients in the camp, because most of them they come straight say they come for IVF.
Yeah.
So when they come for us now for we do the pre-screening and we know it's not the problem. Then we decide now for okay, fine, this will be the treatment for you.
From the experience you don't get inside medical, is it natural for say we get women them way they're not fertile at all? It's like there is no way they're able for born picking. Or now some of the things the way them we don't do at an early stage make them able forget them picking.
Yes, so you get women them way. One of the things I'm going to talk about when the PCOS can make women really difficult for get belly. But that's something if you diagnose them very well, it can be can help the woman later on for a conceive. If we manage them well, we can can be able for conceive. Then you also get some woman there because I can always say for a woman able for conceive, you need good eggs. You need good host for the picking, meaning the womb. Then you need good sperm. So if any of them 3 things are also not the work, it can be a challenge for let pregnancy happen.
Are you able to distinguish between burial and infertility?
So me looking like for use the word say this woman, a barren woman. There are challenges definitely, but if the woman they produce egg, then maybe in womb not good. Then with IVF, we came for harvest that woman the egg, get a man in sperm and put inside somebody else for carry the picking.
So if we look at this, is it possible for let somebody go through the procedure multiple times?
Yes. So a lot of people don't do IVF multiple times before they end up for succeed. Some man they do it one time, it work for them. So usually